There are many. Oh. Me, it's only three I can remember. So it's only three I'll talk of, right? So we have Staphylococcus, epidemis. You see one? We have Staphylococcus aureus, right? And we have Staph saprophyticus. These are the three popular ones that I know, right? Epidemis is only telling you that it is found in your skin, right? So it's normal flora. Staph aureus is also found in your skin, not just skin. 90% of your body is covered by Staphylococcus aureus, even your perineum. Do you notice perineum? You see that space between your anus and your private parts, your vagina or your penis, whatever, eh? Because the perineum is also loaded with Staph aureus. Do you understand? And then we have Staph saprophyticus, right? If the spelling correct, I don't know, but check for me, right? So saprophyticus is usually also found in your skin, right? But among all these staphs that is here, it is the only one that can cause urinary tract infection. And how many is less than 5%, less than 5% of the case. Do you understand? So it's very important that you know this thing, right? Now, urinary tract infection is usually caused by E. coli. One, Klebsiella. I cannot even write ourselves. Proteus. Do you understand? I've written it all, so don't come and be even pseudomonas too sometimes can cause a UTI. How about staph? Say, fam, I've been seeing staph in my urine MCS. If you do urinalysis, right, you will see something they call nitrite. You see this nitrite? Whenever it's positive, it means your UTI is caused by a gram-negative bacteria, not gram-positive. Do you understand? If you have UTI, oh, do you understand? So this Staph aureus is a gram-positive bacteria. You understand? So it cannot have UTI. But I've seen people where they have nitrite is positive, right? In the if you check their test results, and they're not saying they have staph. Sometimes we're like, "Oga, how you take do that test?" Well, this is just by the way. I just wanted you to know this thing, right? So E. coli is responsible for 70% of UTI, Klebsiella, Proteus, and Eros. You understand? Even some UTI, such as urethritis, even caused by gonorrhea. Urethritis that you know. You understand? So this is just part of it. So most of the time, whenever you see staph, right, is a contamination. In fact, there are studies that shows that anytime there are five, in fact, there are five bacteria. Whenever you see them in your as they show positive in your test result, 90% of the time they are contaminations. By the way, do you understand? So if you do urine MCS and you saw staph aureus, you saw this one, staph aureus, it is usually contamination. But if you do blood MCS, blood culture, and then you see staph, my dear, take it serious. Take it very serious. You might be dealing with endocarditis or sepsis or bacteremia. Do you understand? So the only time staph aureus can actually cause urinary tract infection is when you have a bacteria infection. I mean, a systemic bacterial infection, and then the staph moves to your urinary tract system, urinary system, yes, urinary system, and then stays there and cause urinary tract infection. But through the normal route that we all know that I've taught you in my class, staph does not cause urinary tract infection. Do you understand what I'm trying to say? All right. See you in my next video. Please share it, save it so that you can refer to it and argue with as much people as you want to argue.